So
it's actually not the...
so you've been
That's
getting
probably the best.
right. So where have you been getting it? So what? Tell me a bit about it. What's been happening? So
All the way through, but on here.
right.
So like feels like toothache.
Yep.
But from pretty much from there down to about there.
Right. Okay. And when does, like, if you eat or anything, do you feel, is it any different?
No.
No. So when you get in bed at night, obviously it starts to ache a bit, doesn't it?
It aches all day.
Yep.
It's just worse at night, I think, because you're not busy.
Yeah.
So it's not
Yep.
taking your mind off anything, but it's...
Yeah.
Yeah, same.
Any headaches with it?
Not really.
Not really? Good. Right, can you do me a favour? I'm just going to put my fingers over your TMJ. Can you just open your mouth, not that, like a little bit slower than that? Okay. Yep, righto. Okay, close it again. All right, do it again for me. Keep opening, opening, opening. All right, you feel anything when you do that?
No.
No? Can you clench your teeth for me? Anything when you do that? That all feels pretty good?
Mm-hmm.
Okay, so if I go here, whoop, that's really tender there, isn't it? Okay, if I go there, yep, there,
yep.
Okay, if I do this side, not that side, a little bit there.
Yeah.
Okay, so that's your masseter muscles. Okay, all right. And if I come up here, what's that like there?
Yeah, a little bit.
Yeah. Right, so that's right in front of your TMJ. All right, so we've got that little hook right around there. You feel that through there? Yeah, that's nasty. What's this side like? Okay, so open your mouth again for me. Close, open again. Yeah, so you're listing over that way. So when you open your mouth, you're going over that way a little bit. So that tells us that. So that pterygoid's not going to be happy in there as well. All right, so Kath's got some TMJ issues, but originally you thought it was teeth related, didn't you? Yep, so she thought it was tooth related. Obviously went to a dentist, had a few procedures done, they filed it down, didn't they? And it still really didn't make much of a change, did it? And then obviously what's left there is whether or not you've got some TMJ issues or cervicomandibular, but because you don't have the headaches, and I know your neck does get tight from time to time, and you've had treatment on this before, which sort of resoluted it, didn't it? Which was good. Okay. So when did this come back again, Kath?
2 weeks ago.
2 weeks ago. And would you say it's worse than it's ever been before, or it's about the same?
Same.
Right. Okay, so it's neither worse nor... Okay, so I'm just going to work your masseter muscle. So obviously from the bottom of your mandible here, all the way up to here is your zygomatic arch. I'm just going to drag it up. Sorry, I know this is tender. Too much? Can you handle that? Okay, I can back it off. It's not a problem. Right through there. Okay, so what I want you to do, as I slowly work up, I want you to slowly open your mouth, all right? Okay, when I say, all right, just let me get ready. Okay, so slowly open up your mouth. Keep going, keep going, keep going. Cool, feel that? Oh, all right. And again, slowly. So I'm just working up the masseter fibres as she's opening her mouth. Okay, I'm just going to hit those little... So you find the zygomatic arch, which is right about there. Come right off there. That's right in the belly of the masseter. And you'll get a couple of really nasty little trigger points in there. Is that tender through there, Kath? Yep. Oh, got you tight. Oh, yeah. It's quite nasty. All right. All right, I'm going to get you to do the same. I want you to slowly open your mouth, and I'm just going to work through those fibres. Okay, beautiful. Same again, so I'm working along the zygomatic arch. Beautiful. Okay, and again. Nice. Once more. All the way. Beautiful. Okay, good. You all right?
Mm-hmm.
Right. Now we're going to work the bottom fibres. Yeah. That's where it's nice and tender, isn't it?
Mm.
So her lower fibres of her masseter are the ones that are giving you most grief. Which is right along this area, right through here. And they'll refer right into your tooth as well. Give you that sort of pseudo toothache pain. Yep. Sorry. Ooh. Yep. Okay. So I'm just doing some long sweep through there. Tell me how that's feeling.
So?
Yep. Better? Worse? Same? Bit better? Well, I'm going a bit deeper now too. So that's good. That's a good sign. Right, now, get right to the front of the TMJ here. So just open and close again for me. Yep, that's all right. Close it just so I know where I'm at. Yep. It's going to sit right on the front of that TMJ. Just going to do some little circles through here. You've got a couple of really small ligaments in there. They get nice and painful too. Just a little circular motions. Just drop down a little bit further. And a little bit more. And this one at the back here can sometimes refer into your ear. But you've not been getting any issues, have you?
No.
All right. Although that's really quite nasty in there, isn't it? So if you do have clients coming in sometimes who, for obvious reasons, maybe a little bit of toothache sort of type signs, may have been to the dentist, the dentist is having trouble finding where the problem is with the tooth, then obviously sometimes you can be related to this sort of TMJ type stuff. So it's pretty easy to assess because once again, you're going to look at how their jaw's moving, see if they occlude from one side to the other. As they open up, they might list one way or the other. There's a bit of clicking, obviously, on the side where they're quite symptomatic. Clenching their teeth if it's painful to do that, because if sometimes they might be suffering from a little bit of bruxism where they either clench their teeth or they grind their teeth at night. That's also an issue. That's also going to be a bit of a dental issue as well. So that's something you'd want to make sure you're getting covered by the dentist itself. And then you've got two other, I know I've concentrated mainly on the masseter muscle here, but I'm going to get into the pterygoid muscle as well, which is never fun, but this is how we do it. I'm not going to go intraoral, okay? So what I'm going to do is where you've got the angle of the mandible comes here, right along the jawline here. Obviously, what happens is the pterygoid muscle's right underneath that area there. So to get to there and to do that, you're not going to do that just with your fingers. So you need to get a towel and wrap it right under the jawline here. I'm going to get Kath. I'm going to get you to push your jaw out to that side towards me, no, other way. Now, the reason you do that is to soften the muscle off, okay? So then what you do is you sink in underneath the jawline itself, and you should be right up against that muscle there. Now, that's really painful, isn't it?
Mm-hmm.
Okay, so we're just going to, this is going to be 10 seconds, all right? So I just want you to concentrate on your breathing as I do this, all right? You ready? 1, 2, 3, 4, 5, 6, 8, 9, 10. Beautiful. Well done. I know that. I know that's yucky. I know how yucky that is. All right, now open the jaw again for me. Okay, close, open again, close, open again. Yeah, good, that's better. All right, I'm going to do it one more time. Sorry. I know, I'm sorry. I just got to get that last little bit. All right, so you're going to clue it over that way. Beautiful. Okay, here we go. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. Nice work. Beautiful. Yeah, I know. Look, it stings, it's yucky, it's a sensitive area. There's a whole range of reasons why it's not pleasant. Okay, but it makes a massive difference to that jawline. I mean, that TMJ function as well. All right. Feels good. How's that feeling through there now? Any super hot spots
No.
like last time? No, seriously, tell me if there is. Just there. That's that last one there. Right, okay. Right, I'm just going to do some circular motions. So you really don't have to work hard on these muscles. They're small, intricate muscles. It's not like you have to put a lot of force in them. Remember that you are pushing the muscle back up against, obviously, the bone itself. So the feedback can be pretty strong if they're really quite sensitive. Kath's had this done before, which is good. Good. All right. Open now for me. Good. Close. Open again. Slower. What's that last part like when you really open your jaw? Yeah, that's good. Well, that's not listing anymore. That's good. I'm happy with that. Nothing up through here. Okay, clench your teeth for me. So that'll bring up the temporalis muscle, which is up in this area here. So get them to clench and then have a feel of what that's like through there as well. Because if that's sensitive, then it could be part of that whole bruxism clenching sort of type scenario. Good, that's great. Awesome, Kath. That'll feel